We've seen an uptick in plastic surgery. Some people call it the Zoom boom, especially because you can recover with your face covered by a mask, right? But the hands have kind of followed that facial rejuvenation boom, at least what I've seen in my office, patients saying, hey, I want my hands to match my face. So what do you guys think, Anup? What are you guys seeing in Florida?
Yeah, so I also am a hand surgeon, so I've seen an uptick, and a lot of people come in the office and ask, hey, you're a plastic surgeon, you're a hand surgeon, which one are you? But for me, a lot of people, when they come for hand surgery, they look and say, so well, if you're a plastic surgeon, can you make my hands match my face? And so, the FDA has recently said that fillers can be used safely to rejuvenate the hand. And what people are doing is to try to get rid of the veins and the tendons that are prominent and try to fill that in with fillers. I don't know if you have seen some of the same things.
No, just like in Florida, I'm in southern Texas, so the sun too, so lots of dark spots and age spots. So in addition to filling, definitely some laser kind of resurfacing and some lightening of those dark spots with IPLs and things like that. So absolutely. But I think this is almost like a secondary thing. I think, these are patients that you want to keep in your practice longitudinally, and as things progress, if you don't bring it up, sometimes they don't necessarily bring it up to you unless their girlfriend had it done or something like that. So I think it's one of those things I have to ask about. I don't necessarily get tons. You're a hand surgeon, so you get it much different. More. I mean, it's different. I'm looking at their breasts. They're usually not like, and what about my hands? But certainly it's something I think that's important because it tells your age.
Oh, absolutely. Yeah. Oh, and in Beverly Hills, I mean, I have patients who come in, they're wearing white gloves. They hate their hands. They hate the way they look. They hate the skin discoloration. I love using fillers, to help sort of conceal the veins, and then also use some sort of laser to help erase the brown and the spots that they have.
Do y'all have any fillers of choice that you particularly like, or are you?
I think when it's the fillers for the hand have to be relatively very thick because you have to get plump, and it does take considerably more amount than you use in the face for cheeks. Sometimes you use 3-4 vials to get the look, particularly if the person has prominent wrinkles and veins that they need to be.
I do a lot of fat grafting too. I like fat in the back of the hands. I think there's some good skin improvement quality too. So I always ask folks that I'm taking fat out anyways, do you want that put anywhere? Breasts, booty, hands, face, or trash can, any of the above. So,
oh, absolutely.
Yeah, I always ask, yeah.
Fat's definitely the liquid gold, isn't it? Absolutely. I mean, if I'm doing fat grafting somewhere else, certainly the hands is a great alternative. For fillers, I love using a good hyaluronidase filler, and I'll do it with a cannula. Very Fantastic. Little bruising, very little downtime.
Yeah, I think fillers are just, you almost see it right away. Especially with the way that these hyaluronic acid fillers, some of these things really are moldable at the time of injection. With a surgical procedure like fat, you have to deal with the potential of bruising, which kind of delays that kind of social readiness, if you will. So I think that there's no question about that, but then the longevity, skin quality issues, you may have a benefit with something surgical, like we say all the time.